Hey, Ed here. Welcome to another edition of EDTalks. And I really appreciate the fact that you've taken the time to join us. I know your life is super busy, career is super busy, and you've taken a few minutes out to sort of learn. And so as a result, I always make sure I've got the best people in the world to help you with that because I learn a lot from them as well. So today I want to introduce our guest, Dr. Dilip Nath. So Dilip, welcome to EDTalks.
Good morning. Thank you for having me on your show this morning.
Yeah, it's great to see you. Got to reconnect again recently at a Chime event, but we've known each other for quite some time, heading towards 10 years. And it was probably a Chime boot camp, and then obviously I was out in New York City as well, serving at health and hospitals, and we overlapped our time there for sure. And so, Dilip, one way for everyone to get to know you a little bit is to hear about a great customer experience you recently had. So it doesn't have to be healthcare; it could be anything, but just an example of a great customer experience.
Well, I think, since actually after the COVID, the tools and technology that we have deployed for the collaboration for a student, for faculty, and for internal employee, which has been a great achievement, and our people are just love it. Being able to, work remotely and still being so close. I think I hear praise all the time. What a great technology that we have deployed, and actually that bring the workforce together much closer than ever.
Yeah, no, that's great. And is there something like you grew up in Bangladesh, if I recall correctly?
So I was actually born in Bangladesh, and at a tender age of 16, I have migrated to here in the US all by myself. I had no idea, what I was walking into, but here I am today,
Yeah,
many years later.
that's very cool. Is there something your parents taught you or forced you to do when you were younger that you didn't really like it or appreciate it at the time, but now that you're an adult, you look back to the time and you're like, I'm glad they sort of made me do that.
I grew up, in a large family. We have 10 brothers and six sisters,
Wow.
right? So as you can imagine, when one of them left the house, it was probably, they didn't probably miss them much, right? But, and also my parents, they had never had an opportunity to go to school. I was the first one in the family to attend college. Um, and both my parents, they couldn't even read or write, right? But they
Yeah.
understood one thing, right? Which is education was important for their children. And I remember my mom would stay by my, reading table side until I finished the homework. I mean, she had no idea what I was doing, but at least she knew that I was paying attention to the book. I was doing something, right? And I think without her commitment and dedication, I would not be who I am today. And I really, truly, um, value every day what my parents have sacrificed for me.
Yeah. No, that's great. And then, so you've now written a book. So you came all the way from that to now you're an author delivering equitable healthcare. And so we want to jump into that a little bit as well. So before we get there, tell us a little bit about where you serve at Sunny and Downstate Medical Center.
So SUNY Health Science Center University, we are the only academic medical center here in the borough of Brooklyn, serving about 2.8 million people. It's a great organization. We serve a lot of serving community. In Brooklyn, I think majority of the people that live in the borough of Brooklyn that born outside America, and one of the most diverse borough in the country, probably. And most importantly, the most of our doctor that practice in New York, 80% of the doctor, whether it is a student, fellow, or somewhat other, they came to our organization that practicing in New York. So we are truly serving the New Yorker across the state.
Yeah, no, that's a great mission. It's a great organization. What do you like best about healthcare?
I don't like anything about healthcare, and I'll tell you why. I
Yeah.
think it is such an enormous, um, enormously important field, but I think that has lagged so far behind. And not in here in America, but everywhere else. This is such an important component of our society, move the society forward. But there is yet so much disparity,
Yeah.
equity still exists in healthcare. We talk about providing the good and equitable healthcare. Here it is. We still see that every day people are struggling. Technology has not been appreciated the way it needs to be appreciated in healthcare. We are far behind in healthcare. So that's why I say I don't like anything, but we have a long way to go to make the healthcare what it needs to be in the 21st century.
Well, that's very provocative and leads into probably the impetus for writing your book. What was the thought process like? How did you come up with this idea? Oh, I'm going to write about. I'm going to write a book.
I never really thought. I mean, I was thought of writing a book of my life journey, but never thought of writing a book delivering equitable healthcare through technology. During the COVID, we have, if nothing else, our city, our society has exposed how the debt is lost, whether it is in healthcare, whether it is in higher education, you name it. But particularly in healthcare, we were at the epic of the epic center. We have seen hundreds of deaths, and one hospital was 989 deaths in one day, right? And very early on, we were working with the Army Corps to building the hospital bed, whole 9 year and testing center. But one thing I dawned on to me is, what? There's so much we could do to deliver healthcare. We have the tools, we have the means, we have the technology. Why we are not maximizing those opportunities?
Yeah.
People in the 2 years in the COVID, those with a chronic disease, they were afraid to come to the hospital to see their doctor. They suffer those. So, but we could have made those, healthcare available to their, home. There was, politics and policy and all the bureaucracy, red tape had really prevented us to provide the healthcare the way we could have provided. And that's really kind of dawned on to me. So we got to do something more. And I start to, drafting note, and then, every morning I would just write something. And that's really where it led me to write this book, Delivering Equitable Healthcare Technology.
Yeah, you saw this need, this gap really existed all the time, but really during COVID, right, was really exposed in a big way. And so you wrote this book to try and kind of help encourage and inspire others to help close this gap. What has the early feedback been like?
It's been great. I was actually at the time, and there was this is really amazing. I would never forget. So there's one gentleman who I knew a little bit from before. He bought the book, and he saw me at the beginning of this time. Said, Dilip, I need you to sign, the book. I thought he was like really kidding at me. And then I was leaving on Saturday at night, when my flight was 12 o'clock. So I was leaving the hotel at 9 o'clock, and I met one of his colleagues. Oh, my friend Damien is waiting for you to sign the book. I'm like, I'm leaving like in a few minutes. And he immediately called his friend, and sure enough, he was waiting for me at the lobby to sign the book. And I felt that was touched. And the feedback that I got from others, this is very timely and it's very educational for them, because sometimes we take things for granted. And I think if nothing else, it'll at least open the eyes and ear for others to see what potential help, we can bring using technology in healthcare.
Yeah, something you just said, Dilip, made me think, at the next Chime, we should have Chime sort of organize an authors table, because there are quite a few CIOs who've gone on like yourself and written books. And
it was only one of them.
Yeah, it would just be cool to have this table with the books there. It's just not trying to sell books, but really just for people to have an opportunity to interact with authors. I'll make that recommendation.
I'm all for it.
Yeah, I think it's a great idea, because it's like you get to talk directly to the people that wrote it and gain some insights. It's kind of interesting. What's the single biggest takeaway? So if someone said, Dilip, tell me in 1 or 2 sentences what the biggest takeaway is from the book, what would that be?
So in the 21st century, the intersection of technology and the healthcare has ushered a new era. One where the boundaries of what possible in medicine and patient care are being redefined in this book. I think the potential, the opportunity, the sky is the limit. We always say it, but I think I try to at least outline some of those opportunity and the possibility that we can emerge in the healthcare, and also the way we can close that gap. And nobody talks about the technology injustice, right? Or technology justice. But I think that's a core foundation that we have to address, to really to move forward to uplift the society. Healthcare in general, there's an equity, but I think with the technology justice, we widening that gap
Yeah.
and widening the equity in healthcare. And I think before it's too late, we should be really focusing on that. And if nothing else, I wanted to be able to make sure we close that gap and bring a technology justice and healthcare justice.
Yeah, that's a great summary, and I think the book is super important in helping people, again, being very practical and helping others to move that direction, close those gaps, and understand, the environment around that. So I'm sure this happens to you when people find out you wrote a book. They're kind of curious, because I think a lot of people have an idea about writing a book someday, and most don't do it. But for those that have, or others that are interested, they always ask questions. So what was it like writing a book?
It's pretty addictive.
Yeah.
Yeah, once you start writing it, you cannot stop it. You just all the thoughts like comes to you. You want to sit down and write the next chapter. You want to just write the next chapter. It's just so many thoughts come to you. It's really amazing, and it's phenomenal. I mean, I couldn't say any other way, but it's really addictive. Writing a book is literally addictive.
How long, once you started, I mean, because you probably had the idea for a while, but once you started, like wrote down the first sentence, how long did the process take till you were done writing the book? Not necessarily publishing it, but writing it.
But I spent literally the whole, almost until 2022, I believe, on that. I was writing a piece of here. I was kind of all over the place.
Yeah.
I was writing things like I have all these ideas. Then eventually I was able to formulate everything in a way that it makes sense. So
yeah. Well, like you said, it's addictive. Do you have another book kind of percolating in your mind?
actually, quite interestingly, and ironically also, there was another book that just got approved and published in Amazon today. This morning I got an approval. This book I wrote on Bangladesh. Especially the technology and the development that country has done, and since I was born there and it was dirt poor at one time. Now it has emerged, especially economically, technologically. Every member in the country has a somewhat using a smartphone. They do a lot more banking online. So there is a huge transformational journey that gone through the country. So I thought it was important to highlight that, and I started writing a book on that. And actually, I finished that book relatively quickly. I met the Prime Minister when she was here in October. Then she inspired me, and so I sort of finish that book and get it to publish. And actually, publishing in Bangladesh is also publishing that book as well in locally.
Oh, that's awesome. So if we go to Amazon and look at the name, we can find both books.
Exactly.
Yeah. Okay. I'll have to get that the Bangladesh one as well. What's it called?
It's called The Iron Lady, Sheikh Hasina, The Iron Lady of Bangladesh.
Very cool. No, I love that. See, I didn't even know. So it's like this, we're breaking news right here. Dilip's second book has just been released. So is there any other place people should look for your book, or is it pretty much Amazon that you sell?
So right, it's on Kindle and Amazon. Obviously, there are two publishers, one in India and one in Bangladesh. They also publish both books simultaneously. So
yeah,
another local publishers. Let's see where it goes.
Yeah, no, that's a great idea too, because I learned the hard way, that these books become global. If you're selling them, out of the United States, the postage alone to get the book where it's going can be rather definitely more than the cost of the book, maybe by 2 or 3 times. So it's good to have a diversity of publishing options. So that's really good. Dilip, we talked about a lot of things quickly in terms of your background, some of the things that you've learned along the way, but we really focused on the book that we encourage everyone to purchase, Delivering Equitable healthcare, as well as the Bangladesh book. But did we miss something or anything that you want to double down on? I give you the last word.
Look, I think, being in the healthcare, as a leader, I think we have a responsibility to do something to fix this gap. And that's what I'm committed to do, either writing my book and doing every day in the healthcare that I am in, to bring the next level of healthcare. And the next level of healthcare can be really improved with using the AI, the generative AI and other, in improving the workflow and the process. And the more we talk about, more we deliver the good and better technology, we can close the equity in healthcare and equity in technology.
Yeah.
That's really the goal. And I think it's a perfect way of giving back to society and the community.
Well, Dilip, you're a great leader. You have the great heart. That's what I always admire about people is their heart. And, not only doing great things in your community there up in New York City, but you're trying to help others around the world with all the things that you've learned and the things that you care about. So thank you so much for being a guest on EDTalks.
Thank you. Thank you for having me again.
Hey, that wraps up EDTalks. Again, thank you for watching.